Lynn Szabo, PA at Redwood Urgent Care. Time now for Health Matters, and today we're talking about, broadly and more specifically, antibiotics. And specifically, the misuse of antibiotics, which is kind of a widespread thing now, right?
Yeah, absolutely. And why they won't work for your viral syndrome. So we're having a two-peaked flu season, lucky us, this year, and we're kind of getting another wave of flu through the community, but there's also been a lot of secondary bacterial infections. And I think a lot of people come to the doctor wanting antibiotics. I think what they're really asking us is they want something that'll make them better, and they're somewhat conditioned to expect to get antibiotics. But I think we should comment on why sometimes we don't advise antibiotics to be used in certain situations, especially with viral syndromes. So two main kinds of germs in the world, there's bacteria and there's viruses. Viruses have some of the most miserable diseases in humankind that we have to struggle with. And examples of those would be HIV, Ebola, rabies, hepatitis C, but also influenza and, unfortunately, the common cold. Viral infections have to live inside host cells to be successful and to replicate. Bacteria, which is a different kind of pathogen or disease-causing organism, they can live anywhere. They can be on that the door handle. They can be, on your car keys. There's certainly a lot of them on our phones. And they do not have to live inside a host to cause disease. So bacteria are specifically treated with antibiotics and appropriately treated. Viruses are not appropriately treated antibiotics.
You've mentioned some viral diseases. What are some bacterial conditions and diseases that people suffer from?
Well, the one that we're really familiar with in this community is the methicillin-resistant Staph aureus, but strep throat would be an example, gonorrhea would be an example. Stepping on a nail and getting an infection in your foot would be an example. Those are all bacterial infections and appropriately treated with antibiotics.
And I guess you can catch bacterial infections from people, but you can also get them from the environment, right? They don't have to be.
Totally. And the thing with bacterial infections and viral infections is they can present disease patterns that look similar, and so that's where your healthcare provider can take your vitals, take your history, do your exam, maybe do some testing, and kind of decide exactly what kind of disease specifically you have, and therefore what the most appropriate treatment would be.
Because you don't often know. One thing that you say in your notes is that many illnesses have both viral and bacterial causes.
They can be hard to tease out. But what I see is a viral illness, is, especially like in the influenza that we're going through right now, is something that comes on really suddenly. It comes on with really high fevers. People are definitely miserable. There's no doubt about that. And, they go through maybe 5 to 7 days, and then they start to kind of slowly get better. Those people are not going to be made better by antibiotics because their illness isn't going to respond to that. But when I see somebody with influenza and we get past through the initial part of the illness, I start to look for secondary bacterial infections when an otherwise healthy person is about 10 days into the illness, maybe 14 days. When they start to get little teeny fevers after not having fevers, I do not really pay attention to whether they're hawking up green stuff or yellow stuff. I'm more interested if there's blood or no blood. And white spots on the back of the throat don't define strep for us anymore. So
anymore, it almost makes it sound like there's like strep did something differently, but it's our understanding.
No, I think we conditioned people to communicate those particular things to us because then the reward was they would get to hopefully get better faster, but that's not really the case anymore.
I gotcha.
So,
so if you're suffering from a viral condition like influenza, and you start to get better, and then you start getting those little fevers afterwards, at what point should you become worried about a secondary bacterial infection?
I think if you're starting to feel better for a couple of days and then you all of a sudden feel worse, and with influenza specifically, I would look for secondary bacterial pneumonia. So fevers of 99.2 become significant at that time. Losing your breath when you move around becomes significant. All of a sudden feeling sick again when you really thought you were on the mend. Those are all things that the clinician is going to ask about. So
now, worries stemming from the overuse of I guess I feel like I know people who do this when they're sick, regardless whether it's influenza, they jump on the antibiotic. And it seems like oftentimes healthcare providers and professionals sort of, I don't know, cave in that instance and actually do.
We completely cave. There are studies that show that we get better reviews online when we give out antibiotics unnecessarily. And so we know what we're doing, and we know what we train people to expect. But I think most providers who really, really want to do the right thing really want to say at that moment, please don't do this. This isn't good for you. Yeah. This isn't good for you now. This isn't going to be good for you later, and this isn't good for the community.
It isn't good for us in general. I mean, eventually, every once in a while you'll hear dire predictions about the end of the antibiotic age as we sort of grow out of everything that we've come up with. How long do we have? And do you know of anything on the horizon that might be next generation antibiotic?
Well, there are some coming out, but they're not coming out fast enough. The bugs definitely know how to outsmart us faster. And then if you think about it, when you make any medicine, it's got side effects. And if you're making things that are more and more toxic to the bacteria, they might be more and more toxic to the human. I think instead of going in and playing to the antibiotic question, I think it's better if you go in and you tell your provider what your concerns are. Antibiotics are not going to make you better faster. They're not going to keep you from getting sicker. We'd have to treat, I think the data tell us that we'd have to treat 10,000 people to keep one person from getting sicker.
Oh, wow.
Yeah, and they're not going to, if you're visiting your grandma in 3 days and you don't want to get her sick, this is not the way to do it. But I think when you talked about what can we see on the horizon and how far away are the superbugs, I have personally seen people in the last year in Eureka die because they had bacterial infections that were resistant to all antibiotics. I can think of 2 people that we initially saw in clinic that went on, unfortunately, to have bad ends. And that's, we just shouldn't be doing that to ourselves.
And I think culturally, too, just living in the 21st century, it's hard for us to imagine living in a world like that.
Right.
We're so used to being able to take a shot, take some pills for a week, and you're better.
Just be better, yeah. Well, what I would do is give some advice to patients as they come in, and I would also extend this to the providers too. Just understand first what your diagnosis is, and I think it's fair to say to a provider, what does that provider think is actually wrong with you? And then once you get the diagnosis clarified, then treatment can kind of naturally follow. And remember, a sinus infection, there are like 5 causes of sinus infections. Pneumonia, there's like thousands of causes of pneumonia. So try and get as specific as possible so that you get the correct treatment. I think that's really important.
Quick question, just because this is something that pops up to every immunization season. The pneumonia immunization. What is that? My understanding was that pneumonia was bacterially caused, but how do you get an immunization for pneumonia these days?
Well, there's many causes of bacteria. Okay. There's viral pneumonia is a really common diagnosis around here. Bacterial pneumonia is really common. Fungal pneumonias are common. Aspiration pneumonias from drowning, pneumonias from smoke exposure. There's probably a lot more.
Sure. I think in my mind I've just attached the word pneumonia to that specific condition, but really pneumonia just means something in the lungs that's not supposed to be there, right?
Right,
Yeah.
Exactly. Okay. So any kind of infection or chemical irritation that's actually keeping the gas exchange, so keeping the oxygen from getting into the bloodstream, that could be a pneumonia.
So if healthcare providers are sometimes willing to just kind of fall into the antibiotic thing and let that happen, you've talked about knowing your diagnosis, understanding what it is that your physician or PA is saying to you, and knowing what a proper treatment would. What else can someone do to stay healthy?
Well, I think actually if a provider does give you antibiotics, you should ask why, and not just assume that it's understood why. I do give antibiotics when I think it's not necessarily the right thing, but then the patient has to listen to me up on my soapbox and read my handouts on why I think it's a bad idea.
Okay, so
I do cave, but I cave with a little bit of dignity. But other things you can do is definitely get immunized. Flu shots don't really make people sick. And what I would suggest is if you were going to get a flu shot in October, not to get it at the pharmacy, not to get it at the clinic, but go to those nice nurses at the public health department. Not only do they give better shots, and they don't have the wait times, but there's nobody sick in their lobby. So you're not going to get coughed on by the dude next to you and then think it's the shot that made you sick.
Interesting, yeah.
Yeah, so I've never had a bad experience with them, and they're lovely in this community. The other thing is definitely hand sanitizer is good. Washing hands, you just wash them with water. Even just the mechanical action of water is really helpful.
And heat too.
Yeah.
Is antibacterial soap, is that a bad thing?
Well, we use it all the time, so I'm hoping it's not a bad thing. There are some studies that suggest that maybe it is a little bit of a bad thing, but influenza can also kill people. Yeah. So you're weighing risk against benefit there. I don't think there's any clear data that would make me avoid it.
Okay.
But, I'm with sick people all day too. So
yeah, what do you know? No, that's also I know that taking one thing, of course, is if you're given a course of antibiotics, is to finish it. Don't stop when you feel better. Right?
Well, this is exciting news. Actually, the courses of antibiotics are now being more abbreviated, and so it's not uncommon for some infections to only be treated with 3 days, 5 days, or 7 days. Wow. The magic 10 days was never data-driven. And so now we're finding we can do more with less, and I think that's exciting. But if your doctor says to take it for 7 days, take it for 7 days. Don't have any extra lying around, because it's not going to come in handy down the road. It really isn't. And I have seen people really impact the way we can work up a disease and really kind of hamper our understanding what's wrong with them because they just took their mother's leftover Augmentin.
Oh, wow.
Yeah, so I would advise against doing that unless you really know what it is you're doing and you have some good reason to understand what your clear diagnosis is.
And antibiotics, too. This was something somebody pointed out to me, and you mentioned it here. They kill all the bugs. So you've got bugs in you that are good, that are in you all the time, and you'll often get side effects and things happening because of that, stomach and digestive things.
Right. So not only the risks of a possible allergic reaction, which can happen at any time, and we become allergic to things we're more repeatedly exposed to. So if you say, I've had penicillin in the past and it hasn't been a problem, it doesn't mean that's going to continue. So the other thing is it actually causes normal flora to be disrupted, and our normal flora biome is really important to keeping us healthy. They're thinking intestines now are actually part of the immune system, and so you can get diseases like Clostridium difficile, which is a horrible diarrhea that's quite debilitating to people just because somebody has taken antibiotics maybe when they shouldn't have.
Oh wow!
Yeah.
Oh my gosh.
Yeah. So probiotics become really important when you're taking antibiotics, and certain antibiotics more than others. But your provider can guide you on the details of that.
And of course, common cold, viral infection, cold. You still can't do anything about that, can you?
No, our old saying is that if you have a diagnosis of a cold, it'll last 10 days if you don't take antibiotics, and it'll last a week and a half if you do. So. Yeah,
that's actually really funny.
Talk to your doctor. Tell them what bothers you, because the symptoms can be mitigated. We can treat symptoms like if a cough is keeping somebody up at night, or if nausea and vomiting is a problem, or expect to see more use of steroids. Actually,
really? How so? Well, I've seen that actually. I've seen that in people I know who for different reasons, and I always wonder, how does that work? What's different about a steroid? I don't want to get into a whole other health matters here. But
well, a steroid helps with the inflammatory response to an illness. Say somebody has a viral sore throat and their rapid strep is negative. Then sometimes there's swelling and redness and pain in the back of the throat that can really be controlled with prednisone. And we could just give a short course of it. It's not very long. To be truthful, this is mostly a comfort measure most times, and a person can get better without it. But I always offer it, because if somebody is wanting to be better fast, that might be a way I can make them more comfortable. It might be a way that I can get them to sleep better. And sleep, we have to remember, is also medicine. And
it seems, yeah, exactly. And also it seems like the best weapon against all of these sort of common infections that are just sort of waiting out there to be encountered by us is a healthy immune system.
And time. Our body has some wisdom. It's just not very fast about it. So,
Lynn, thank you very much. Anything else you'd like to add?
No, but I'm looking forward to our next talk. I'm thinking maybe we can talk about how you might interface with your provider better and what you should bring to be prepared for that visit that you've waited so long for.
That's an excellent suggestion. That's fantastic. We'll do that because, yeah, it seems like having the right questions, having the knowledge, and going and empowering yourself instead of just sitting there waiting to be told what to do. You sort of have to champion your own health these days.
Yeah, we want to hear from you. We want to do better. So it
Be
has
your
to
own
be
best
dialogue.
advocate.
Yeah.
Lynn, thank you very much.
You're welcome.
Lynn Szabo from Redwood Urgent Care, Health Matters. We'll talk to you next week.
All right. Thank you.